we're going to take some impressions of your top and bottom teeth today. So what I want to do first of all is to have a look at your mouth, and we've got some impression trees here. We want to check which one is the right size for you, and then we'll take the impression and then we'll check how it looks after that. Okay, so can I have a look at your teeth first of all? Is that okay? So what I'm going to do is put this light on, and then I'll let you just stretch your head back and just adjust that slightly. So what I want to do next is to check which impression tray would fit your mouth. Is that okay? Yes. So we'll start with the smallest one. What I'm going to do is just stretch your cheek out the road so we can fit the impression tray in here. And we'll see how that fits in over your lower teeth. That's not bad, but it's probably a little bit small, so we'll take that out and we'll try the medium size and see how that fits. So once again, we'll just stretch your cheek out the road and see how that will fit over your lower teeth. And that looks to be a much better size now. That's good. What we shall do is we'll just try the large one in just to see if it fits or if it's too big indeed. So again, we'll just stretch your cheek out the road and see if we can fit this impression tray in. Now that to me looks as though it's too big for your mouth. Does that feel as though it's too big? It does. Okay, so I think we shall use the medium sized tray. And once again we should try the same for the top as well. So we'll start with the small one and see if we can stretch it in here. But that definitely feels too small to me, so I think we should take that back out and try the middle size. Again, you'll stretch your cheeks and try and fit it in as neatly as possible. And that looks like a perfect fit, that one, but again we'll just try the large one to make sure that it probably is too big. Yes, that definitely feels too big to me and probably to you as well. Okay, so what we will do next is we will take the impression. We'll start with the lower one and we're going to put some impression material in the impression tray and then squash it over your teeth. Okay. Putting the impression material into the impression tray just by gently squashing it in. And then we'll pop the impression in your mouth this time. So like we did before, we're going to stretch your cheeks out the road and gently squash it over your teeth. What we'll have to do is, while we're putting the impression tray in, is just move your cheeks gently out the road as we squash it over. And then we're just going to gently stretch your cheeks over the impression so that we get all the teeth in the right place. And then it's going to take about 2 minutes for it to set, and then we'll take it back out again. That should be set fully now, so we're going to take the impression out now, okay? So we're going to use the handle just to lift it up and then press up from underneath and encourage the impression to come out all the way around. And then we should be able to see the finished impression. Press the impression material into the impression tray once again. Make it nice and smooth. And we're going to just take off the excess material so that it doesn't go down the patient's throat. And then we're going to put the top impression in now, just like we did before when we tried the impression tray. So we're going to stretch your cheek out and actually rotate the impression into the patient's mouth. And holding the lips and cheeks away, just gently press the impression into place. what we'll do, we'll just gently stretch the lip back over so that we get a nice detail of the soft tissues, and then just look down the patient's throat to check we don't have too much material, and that looks fine. So this should take about 2 minutes to set once again. And just check it's setting nicely. We hold the upper impression in place because gravity will make it drop down, and that can lead to all sorts of faults with the impression. Good, and what we'll do, we'll take the impression out now, so we'll just stretch the cheek out the road and just gently ease the impression out of the patient's mouth. Same on the other side, just gently ease the impression out of the patient's mouth. Impression in your mouth, okay? I'm just going to gently press it over your teeth, and once we've put the impression in, we're going to leave it for 2 or 3 minutes to let it set now, okay? Hopefully that should be fully set now, so we'll take it back out. Have a look at that. And unfortunately it's not a very good impression because we've got some air bubbles all around it, and we've missed some of the area down the lingual sulcus near the tongue, and unfortunately the impression has started to come away from the back because we didn't take it out properly. That's great. I'll just put that into the impression tray once again. That's perfect. Just going to stretch your cheeks out the road and just put this into your mouth now. Okay, and it'll just take a couple of minutes to set. Just take that out now, okay, so just like we did before. There we go. So this time we've not got a very good impression because there's too much material over the back of the palate going down the patient's throat. There'll be quite a big air blow just in at the rear and the upper left molar region, and we've got very poor definition of the labial and buccal sulci. Lower teeth, and then once I've got it in there, just get you to bite your teeth together now for me. That's super. And I'm just going to gently just press it onto your lower teeth, and then you can open again and we'll take it out. That's super. Good, and then we'll put that into the tank. Okay, thank you. So we're just going to clean you up now. So the nurse has got a mirror for you. We're just going to clean any excess off the corner of your mouth, and then there's a dry tissue just to dry you off again. Okay, thank you very much.
Thank you.